4, 3, 2, 1.
All right. Good afternoon. Welcome again to an update from Marion County on COVID-19 and our response to this continuing crisis. I'm Mark Ramey, Chairman of the Marion County Board of Supervisors. I'm with our Director of Public Health, Kim Dorn. We wanted to provide you with the latest numbers, the statistics as we have them currently regarding COVID-19 cases within Marion County. So Kim, I think this is a good place just to give folks a review of our case counts, our active cases, kind of put things in perspective for folks.
Okay, very good. Well, we currently have 176 cases that we have served throughout the entire time.
So let's be clear about this. When we say 176 total cases, that's from when this crisis began to date.
Correct.
Right. So that's our total over the time that we've been under this COVID-19 crisis.
That is correct. And we currently have 20 active cases.
Okay. So we have 20 people that we know of within public health that are currently infected.
Correct.
Okay.
Correct.
Right. So that's when you think about it from a Marion County perspective, out of a county of more than 33,000 people, that's less than 1% of our population. It's about, I'll do the math real quick, about 6/100ths of 1%. I'll have people checking the math, I know, but that's okay. So we have a very small portion of our population with an active infection right now. Is that fair?
That is true.
Okay,
Yes,
good.
that is true. Yes. And so of those case numbers, for total cases, our 0 to 17 age group has been 12% of the cases. Our 18 to 40-year-olds have been 39% of our total cases. Our 41 to 60 age group have been 30% of our cases. And so keeping in mind that those 18 to 60 are almost 70% of our cases in Marion County from the beginning.
Okay, good.
So working age people,
Right.
pretty much.
So from our long-term care facilities, our nursing homes, we're still staying in contact with all of those locations.
Yes.
And helping those individuals still mitigate through behaviors and PPE and those mitigation processes, correct?
That's true, yes. And we have been very fortunate that we still have had no outbreaks in long-term care. We are very blessed that we have had no deaths in Marion County. So that part is looking really good still.
Yeah, that is good. And I think as we reopen, people get back to work, our schools begin to work on plans to open schools up. I think it's encouraging to note, even though we have people that have it, and even probably some serious cases, it's still a very small percentage of our overall population. People have been very responsive to the social distancing, the hand washing, those critical behaviors that we talked about clear from the very beginning. Is that fair?
That is fair. And we need to continue doing that.
Yeah, maybe a good time to just walk through that again, Kim, and remind people that the virus is still here.
Mm-hmm.
We do not have a vaccine. People talk about a vaccine on the news,
Right.
but we still do not have one. So the behaviors that we have talked about, we still have this chart up here. We've shown it many times, but these behaviors are still valid,
Right.
correct? From a
That's
public
correct.
health standpoint?
That's true. So I can't emphasize enough social distancing. The 6 feet from people who are not your normal contacts, and washing hands and using hand sanitizer, avoiding touching your face, sneeze or cough into a tissue or in the inside of your elbow. Disinfect frequently used items. Stay home when you're sick. That's the biggest one that I can really would like to focus on, is if you have a positive result of a test, you need to stay home.
Mm-hmm.
And if you have come in for testing, while you're waiting for those results, you need to stay home.
Okay. Okay.
We've had folks that come for testing and then they don't stay home, and then they turn out to be positive, and so they're out spreading. And so when we ask people to stay home, we really need them to do it.
Okay, that's a good point, and something we need to emphasize to all of our residents. Of the 20 active cases we currently have in Marion County. That's what we know about.
That's correct.
That's what you and your staff
That's
know
right.
about and are currently working on in terms of contact tracing and then working with those individuals.
Right.
But we do believe there are other cases that we don't know about. And one of the reasons is that when we do a test and we find a positive and we say you need to stay home for a certain period of time and we provide that advice and people don't do it, well, then you have an issue, right? And we
Right.
don't issue orders and there's nothing illegal about those things
Right.
at all. But we just want to really encourage folks that if you are positive, it's not a stigma, it's not anything. Again, this virus didn't come from here. We're dealing with the fallout of something that did not come from the United States. But to mitigate it, we've got to do these things.
Correct.
Okay.
Yeah.
Good.
Yeah.
What about masks, Kim?
Well, if you choose to wear a mask, you really need to do it properly. And if you can't keep properly socially distanced within 6 feet of people that you know and are part of your tribe, and so if you can't properly socially distance, you may choose to wear a mask. And if you're going to wear a mask, you need to have it over your nose and over your mouth, because if it's here, it doesn't do you any good. If your nose is not covered, I know it's easier to breathe. It doesn't fog up your glasses, but it's not doing you any good either, and it's
Right.
not protecting anybody.
Right. From a public health standpoint, Kim, on masks, they're not airtight.
Right.
And when it's not airtight, there's still potential for exposure, correct?
That's correct. In fact, we just got off of a webinar with the state health department saying that if you're within 6 feet and you're wearing a mask, it's still going to be considered an exposure, and we're still going to quarantine.
Right.
So it's not it provides some protection in that maybe it doesn't, like if you cough, it doesn't go as far, but unless you're wearing an N95, you're still going to be considered quarantined.
Right. I think we need to make this point very clear to everybody, but I think there's been a lot of confusion. There's been a lot of political issues put onto masks. And the fact of the matter is it's not an airtight, unless you're wearing a wetsuit and goggles or an astronaut suit. If you're within 6 feet, there's still the potential for exposure or transmission.
Right.
And so we need to the social distancing still is really, really critical.
That's if I had to choose one thing, it would be social distancing.
Okay.
And washing hands, but
Sure.
but that's two things. One thing, social distancing.
Okay, good. Very good. So what about updates on testing?
We continue to do tests at Marion County Public Health. The hospitals and clinics are also still doing tests. Again, we've kind of had this agreement with the hospitals and clinics, both hospitals and their clinics, that symptomatic folks would go to their, we refer them to their physician, and they do the testing for folks with symptoms. We do, if you're exposed and just kind of concerned, then we do that at public health. We can also do people who are symptomatic to try and sort that out, but the hospitals and clinics are busy taking care of sick people, and so they would prefer to not do testing of the worried well.
Okay.
So,
Very good. Very good. So as we conclude this part, before we go to Mayor Hatch, who's on to give an update on Knoxville, continue to socially distance,
Correct.
wash your hands,
Right.
stay at home if you're sick.
Yeah.
Those are the critical behaviors. If you wear a mask, do that, feel comfortable doing that. For the folks that aren't, remember that it's social distancing that is your primary defense against the spread of COVID-19. So if we keep that in mind, we'll continue to slow the spread within Marion County.
Yeah.
Is that a fair assessment?
I think so. And if you choose to not wear a mask, be really, really cognizant that people who do want to wear a mask, they don't want you closer than 6 feet.
Mm-hmm.
I mean, if they're wearing a mask, they are doing that for a reason. And so those non-mask wearers need to be really understanding that those folks who are wearing a mask, they don't want you closer than 6 feet.
Right. It's a good reminder, Kim.
Yeah.
So with that, we'd like to invite Mayor Brian Hatch to join us. We've got the mayor on Zoom, I believe. And Brian's going to give us an update on Knoxville and some of the activities going on in the city of Knoxville. So, Mayor Hatch?
Yeah, thank you, Mark. Thanks for having me on. My message is going to be pretty similar to Kim's, which is good. First off, though, I do want to, with the races coming up for the next couple weekends here, I want to welcome the fans that are here already and the ones that are coming. We're glad to have them here, and we hope that they enjoy their stay. But I want to say thank you to racetrack, emergency management, public health, city of Knoxville staff, everyone for all of their efforts in making all this happen. I know it was a major undertaking to plan, organize the next couple weeks of racing here. So I just want to acknowledge their efforts in creating this opportunity for people to come out and race while trying to keep the fans and our community as safe as possible. So I want to say thank you for that. And with that, I just want to encourage everyone during the races, both the fans and our community, please follow the CDC and public health recommendations inside and outside the racetrack. Like if you're a high-risk person or you can't follow social distancing, protect yourself by wearing a mask, protect others, wash your hands, cover coughs, all of that kind of stuff that Kim just talked about. Our city staff will have a command post set up at Youngs Park, just south of the racetrack. This will be to handle everything from, COVID-related issues around the track, safety at the track, just general support and operations throughout the city. So if you need something, take advantage of that situation. We will have that command post set up there at the Youngs Park area. Again, I guess just happy to have everyone here. I asked everyone to do their part to keep everyone safe. Enjoy the week of racing. Enjoy city of Knoxville. Hopefully we can have everyone back next year under maybe more normal conditions. Thank you and be safe.
Great. Thanks, Mayor Hatch. We appreciate you joining us this afternoon. Thank you for that update. So again, to just reiterate, we have 20 active cases right now in Marion County that the Public Health Department is currently doing contact with those individuals. Again, that's a very, very small percentage of our overall population. Our residents, our businesses, churches, everybody has done an outstanding job in slowing the spread here in Marion County. We have been fortunate that we've not had a major bloom in one of our long-term care facilities and nursing home facilities. That doesn't mean it can't happen. It also doesn't mean there are people that have it that we don't know about yet. So again, social distancing, hand washing, stay at home when you're sick. I think Kim said that during her comments, and we just want to reiterate that those are the behaviors that will allow us to continue to move forward, operate as normally as we can in a season where there is no vaccine yet for COVID-19. We're heading into August, so soon we'll be talking about colds and flu.
Correct.
So we also have to be mindful of those things as well as this becomes part of what we talk about with COVID-19, and we'll have some discussions on that here in the next several months. So stay tuned. Thank you for your time, and we'll provide another update very soon. Thank you.